that's not why you work hard your whole life. You work not to just make money, but to have a lifestyle that you can enjoy with the people you love. So for me, that's what real beauty is, and being balanced.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Julian Gershon, who is triple board certified in family medicine, sports medicine, and anti-aging and regenerative medicine. He also holds fellowship in stem cell therapy awarded by the American Academy of Anti-Aging and Regenerative Medicine, and is a fellow of the American Osteopathic Academy of Sports Medicine. Dr. Gershon is dedicated to providing his patients with the health care they deserve, with a primary goal of helping people enjoy the best possible quality of life. So, Dr. Gershon, welcome and good to have you here.
Thank you. Great to be here. Enjoy it.
Yeah, so let's start off with this. I'm curious, how did you first get interested in medicine?
Oh my, that goes back 45 years plus. Yeah, I've been in medicine for 45 years. I grew up in a medical family. My father was a physician who practiced until he was 92. I, mentioned him in my book that he was 99 at the time I wrote it, and he just passed it, just under 101. And
Wow.
was an amazing, amazing guy. And so I had a great role model. His brother was also a physician. And so I, grew up in a medical family, riding with them to make house calls or go to a nursing home or cover Friday night football games, and he was really one of the founders of sports medicine in the United States. And I think in fifth or sixth grade, I was carrying a bucket out onto the field with a ladle for players, timeouts and half times. And, it was just something that I grew up doing. And it really was the only thing I ever wanted to do, was to go into medicine and be like my dad.
Okay, so you started off in sports medicine. So when was the transition when you started getting more into anti-aging, regenerative medicine, that type of medicine?
Well, it was interesting. And I do mention it in my book as well, because I was on the board of our National Academy of Sports Medicine. And back in like 89, I was at a board meeting and looking for a friend of mine, Bob Goldman, who is one of the founders of the American Academy of Anti-Aging and Regenerative Medicine, him and Ron Klatz. And I remember somebody telling me, well, he's doing some anti-aging thing. And I literally thought he was nuts. And said so in my book. I'm like, oh, Bob's lost it. And then in 2000, I was turning, and I was 50-ish, and was starting to feel the effects as an aging athlete. I grew up ski racing, playing a lot of sports, still play a lot of golf. And at the time, it started to make sense. And I went to a conference in Las Vegas for the American Academy of Anti-Aging and Regenerative Medicine, and gone every 22 years, every December since then. And I was shocked. There were at that time several thousand physicians and providers from all over the world. And I was just hearing about it. And when I really sat through lectures, listened, it made sense to me, as an aging athlete. So it made sense for me personally. And I started learning and being patient number one, so to speak, and experimenting with testosterone use, vitamins, nutrients, DHEA, other things. And I felt great. I felt, like I had in my 20s. And so I became committed to make it a study, and I kept doing sports medicine, family medicine for many years after that, until about 2014. Then I completely dedicated myself only to anti-aging regenerative medicine, although I have seen patients and learned bioidentical natural hormone therapy, for 22 years now. I did my stem cell fellowship through A4M, the American Academy of Anti-Aging and Regenerative Medicine, back in 2012. And so really it's just been a constant process of learning more information, the latest studies, literature, articles, backing up what we do with the safety of natural bioidentical hormones, learning, about stem cell harvesting, banking, the use of exosomes, umbilical cord blood, umbilical cord products, a number of things. So it's never ending. I was just at a seminar this weekend in Scottsdale with Dr. Morgan Taylor, the world's most famous urologist from Harvard, who was the one that discovered and did all the studies and biopsies of men on placebo and those on testosterone to prove that testosterone does not cause prostate cancer. That's still a wives' tale out there. And so it was a great weekend with him. 2 weeks before that, I was at my annual hormone summit with Dr. Rouzier, Neil Rouzier, and World Link Medical, doing updates on all the latest literature for men and women, and really learning a lot more on that one about the safety of estradiol being actually breast protective for women, about this, using oral estradiol for women over 50, and the significant reduction in risk of heart attack and stroke risk. So there's always something that I'm learning and utilizing as much as I can myself, and then sharing with my patients. So that was really the transition around 50-ish, which is now 22 years ago. I'm 72, and other than this rotator cuff issue I have right now, I feel pretty good.
Yeah. You look very, very, very healthy, very lively, and I would have never guessed that you'd be 72. Never would have guessed it.
Yeah.
Okay, so Dr. Gershon, you have your practice, the Aspen Institute for Anti-Aging and Regenerative Medicine. Why start your own practice? I mean, why not just work somewhere else? Why did you really want to set up your own practice?
Well, it's all I've ever done. I practiced with my father for the first 5 years in the late 80s. And then I moved to Texas, and, I was a head team physician at the University of North Texas for 20 years. I founded my own family and sports medicine clinic at that time. And I just always, I guess, had an entrepreneurial spirit and enjoyed working with patients. And I found that a lot of other providers, and this is not true of everyone, so I don't want to generalize in the wrong way, but when you're in a healthcare system, it's like being a banker. It's a 9 to 5. You go in, you go out, you work. If you're not on call, you don't answer the phone. I love my patients. I answer the phone. They all have my cell phone. None of them abuse it. Not usually, but I want to know what's going on, and if they don't feel their best, what can I do to help? And so I've just always had that attitude. I learned it from my father. I watched him do it. I worked by his side, and said, this is how I want to practice medicine. This is how I want to apply what I've learned to people that put their faith in me and trust me.
Very well said. Now, I want to dive a little bit deeper into the actual treatments that you provide, Dr. Gershon. But first, before we dive into that, we've been talking about anti-aging, regenerative medicine. So from a high-level view, I guess if you were to explain this to a fifth grader, what is regenerative medicine, and really what's the main benefits of it?
Wow. Well, there's so many aspects now of regenerative medicine. That's a difficult question to answer easily. Anti-aging and regenerative medicine to me is taking us back to a state of our best health and regaining optimal health by balancing hormones, by utilizing natural bioidentical hormones for men and women. I call it baking the cake. I say first we got to bake the cake, and then we can ice it with all kinds of things, from peptide therapy, micronutrients, vitamin, biologic age testing, glycan age testing. There's so many things and parameters that we can look at to see where we are today, and to make a plan to regain, a youthful and optimal state in our bodies. And so what it entails is, and being a sports medicine physician, I've always believed in, optimal human performance. How do you want to, nobody intends to go out and and give it 50%. If you're playing a sport, as my dad used to say, you either give it 110% or don't give it anything. And so whether it's 110% his way or 100% or whatever your very best is at something, it's hard to do when you don't feel your best. And so to me, that was the key to start to try and make an impact there. And then utilize new therapies. When I started doing hormone therapy 22 years ago, that was it. Vitamins, nutrients, testosterone for men and women, natural, safe, bioidentical hormones for women. And then 12 years later in 2012 is when I did my stem cell fellowship, when I learned the isolation techniques to take fatty tissue, adipose tissue, and extract mesenchymal stem cells for immediate use and for banking for future use. And so, that's when really although optimizing all our hormones is in reality regenerative, because improvements in muscle mass, body composition, decreasing inflammation, because inflammation's the silent killer, and it's inversely related to all of our hormone levels. So we were already doing things that were, quote, regenerative before stem cell therapy, but that then was the big turning point as far as really being able to offer things. When I think of the many hundreds or thousands of clients that I referred for surgery, and I have plenty of friends that are great surgeons, and there's a time and place for everything. But with small cartilage or meniscal tears, damage, labral tears in the hip or shoulder, things that if I had just injected even their own blood, platelet-rich plasma, or their own stem cells, or an exosome product, or any kind of stem cell product to regrow cartilage, reduce inflammation, help regrow tissue, and heal that joint to stimulate the natural healing process, that's when it became really regenerative. And it's been a process because it just keeps getting better and better. Although I've done the same stem cell procedures and banking since 2012, going on 13 years, or was 13 years in June. We're always finding ways to make it better. The banking techniques are better, being able to utilize those cells for the rest of a person's life at a significant discount. It just all makes sense. And so that's really how it all transpired, and it continues to change, with DNA methylation testing, genetic testing, identifying root causes of many diseases that then can be treated by not just hormone therapy, changes in diet, nutrition, lifestyle. We do a simple test called the Fit Gut Test that shows components of leaky gut syndrome. So many people have leaky gut that really don't know it. They know maybe they have stomach problems, maybe it's just swelling and inflammation in their hands or joints. But we test for inflammatory reactions to over 176 different foods. And by simple elimination, you can transform the way a person feels. And by simple changes in diet, some botanical compounds, the use of glutamine, we can heal leaky gut syndrome. And so, it's really, we're always learning and always looking for ways to do things better. And so that, to me, is why I love being involved in regenerative medicine, applying it to everything I've learned and done for 45 years in sports medicine to be better, to just be a better provider, to feel better myself, and share that with my patients.
You mentioned the words optimal human performance, which I think is really key. So it's how my understanding of when you described that was, how can you get 100% out of yourself using natural ways that really utilize how your body's supposed to work? Is that really the essence of regenerative medicine? Like, you're trying to use, get to your best 100% using natural methods or methods that really work.
I would say so, yeah. And you can't do it without adequate hormone levels.
Mhm.
I've known a lot of trainers and a lot of athletic trainers, personal trainers, fitness coaches that, have started to experience themselves and will come to me and say, hey, what's the deal?
Mhm.
I'm starting to have issues. And well, yeah, they've already been eating correctly and to whatever their definition of that is, of
Mhm.
staying hydrated, of putting good nutrients in the body. But there comes a time when, it's just an uphill battle. If you
Mhm.
have, inadequate testosterone levels, poor growth hormone levels, and that's what I like about peptide therapy. It's not expensive, it's reasonably priced, and we can do things, use isolated small chain amino acids that have specific actions in our body to improve on our performances
Mhm.
and the way we feel every day.
Okay. And when it comes to regenerative medicine, you kind of alluded to this earlier, where you can use it for a lot of different things. It's not just only one application. Um, so you can use it for on the aesthetic side. I know people are doing it for like the PRP or the PR for hair growth or to build more collagen in the skin. But I also know that regenerative medicine can be used more for the like joint pain, back pain, neck pain. So I want to dive a little bit deeper into more how stem cell therapy can help with muscular skeletal issues. I think that also, based on your sports background, is also very relevant.
Yeah, well, I mean, it's as I said earlier, that was one of the things that excited me the most is that, I had a way to treat patients that either just had to keep taking anti-inflammatories or quote, come back when it's bad enough that you're ready for a joint replacement. And they were miserable. And that was me. I had a hip issue, a knee that I blew out ski racing. It wasn't just going to get better. When I shredded all the cartilage off the back of my kneecap, yeah, they shaved it down and rebuilt my ACL. I knew that part would be fine. I went to the Stedman Clinic in Vail. They one of the best in the world, and they did my surgery. But that cartilage was not going to grow back under my kneecap. And so that's when I used my banked stem cells for a series of injections to completely grow back all the cartilage. It doesn't, the grating and grinding sound, we call that crepitance. It has no crepitance, it never hurts, it never swells. And that was in 2012. I had
Wow.
2 injections within a year, and I have never had any joint pain since. And I have a lot of clients that are the same way. So when we can take your cells, or let's say if we used an exosome product, which comes from pre-screened donors taken at the time of birth from either amniotic fluid or umbilical cord tissue, and isolated where there's over 300 proteins, growth factors, messenger RNA, everything that stimulates healing, put it in that joint and watch it, just gosh, almost magically start improving in a very short period of time within 4 weeks, 6 weeks,
Wow.
8 weeks.
Mhm.
It really is more than just rewarding. I mean, it's very exciting therapy and to see patients go through that were miserable, it's a big deal,
Mhm.
when you can prevent them from having significant downtime, more pain. So it's, to me, that's one of the best
Mhm.
applications is what we can do to help people with joint injuries.
Okay. So
Because we all wear out over time. If
yeah.
we're active enough, whether it's hiking, biking, skiing, running, whatever, you're doing some significant long-term damage to your joints. You don't know it at the time, and
Mhm.
you're not going to change your activity because you love what you're doing. But now instead of stopping and finding the couch, we can do something to restore, your mobility, reduce the pain to nearly zero or zero in most cases, and allow people to regain their activity.
Mhm. So people that are suffering from joint pain, this at least this option is something that they should definitely look at first before considering surgery. Would you say that's a fair statement, or is in some situations they really do need surgery if it's
Well, it depends, if they have, I would say absolutely, it's a real alternative that should be explored. but they need to find a skilled provider that can honestly tell them the difference. I don't inject everyone. If they have, let's say, what we call a bucket handle tear of the meniscus in your knee, in other words, it flips up when you do certain activities and locks, well, that's not going to go away. It has to be either sewed back down or removed. In the old days, everything got cut out. Now we know that we want to preserve all the cartilage you can. And so that would be repaired by a skilled surgeon. They even sometimes do some cartilage grafts, different things. But I see a lot of people following surgery from their knee or hips and say, hey, I want some exosomes, or let's do my stem cells, and to accelerate the healing process so they get back to 100%, because, not every surgery goes that way, irregardless of the skill of the surgeon. We're talking about your own anatomic tissue. Sometimes the damage that's done, can only go so far, but when we add regenerative treatments to it, we can restore that.
Okay. So a very exciting option for people who figure out, oh, it's joints is completely gone. Oh, I have a surgery. I don't want to do surgery. It's too invasive. I'll just suffer through the pain. So it sounds like this is a really good option for them, at least to consider and explore.
Yeah, and probably half of the people that I see with knee pain and osteoarthritis, whether they're in their 50s or 70s, they're told, hey, you're bone on bone, you need a knee replacement. Well, just because there's not much joint space left doesn't mean there's no cartilage. So it depends on X-ray and or MRI findings, and then most importantly, the physical finding. How does it feel? I see some things that look terrible, but when I examine them, it doesn't feel that bad. They don't have a lot of crepitance, and it's not excruciating painful. It's uncomfortable. Let's say it's a 5 or 6, or when I do certain things, it's an 8 or 9, but it doesn't feel too bad. Those people are generally very good candidates for a regenerative treatment.
Okay. Now, Dr. Gershon, I want to switch tracks a little bit. We talked about more of the musculoskeletal issues. I want to switch over to the anti-aging side, particularly your ultimate Aspen experience, anti-aging makeover. I want to learn a little bit more about that. What is involved in that? That's one heck of a name to begin with, but what is it?
Well, it's exciting. It is everything that can be done in the anti-aging and regenerative space for someone in a week's time frame. Now, we continue the program over the course of a year as far as following hormones, doing lab work. Things need to be done in a very specific way. But we do very exhaustive laboratory testing in advance. We do DNA methylation testing, telomere length testing, biologic versus chronologic age, micronutrient testing, fit gut test. We even can do the Gallery cancer screening test to screen for over 50 different cancers. And then we do kind of a deep dive examination and history and physical to go into everything with that person's diet, lifestyle. We see our nutritionist, and I do make a plan. We also, during that week, will offer aesthetics. We can do PRP, exosome or stem cell facial treatment, scalp injections for hair growth. And the core, again, is starting natural bioidentical hormone replacement to the degree they need it. And there's almost no one that doesn't need something. Certainly if you're perimenopausal or menopausal for women, that's easy to understand. And most all men, we start losing testosterone as early as 30 at 1 to 3% a year. With all of the estrogenic compounds and microplastics, I never used to see guys in their 20s and 30s. I have dozens of men in their 30s now, and certainly in their 40s. 20 years ago when I started, it was 55 and up. And then each decade, it's come down 10 years. And so I have the majority of my practice right now is probably between 30 and 55. Okay. And so younger guys in their 30s and 40s, I do not treat with testosterone. I use clomiphene, a fertility drug, HCG, human chorionic gonadotropin, things that stimulate the testicles to make testosterone. And in most cases, it works very well. So they may go another decade or longer without actually having to take testosterone. Why are they not making it? Why is the factory down? Well, all you have to look at is all the things we're exposed to environmentally. I mean, the microplastics are in everything, BPA, estrogenic compounds, soy, things that aren't good for men's health. And so, and there's more awareness now. So guys, don't feel their best and well, maybe I have low T. Well, lo and behold, yeah, it's 300. You have low T. What do? We don't use testosterone. We're going to turn it back on and help you turn that on. And there comes a point that not 100% of younger men are responsive to that. Yes, we do use testosterone, whether it's self-injection. I do pellet therapy. There's a lot of different ways to skin the cat, so to speak. But it's important to recognize that we are really in an interesting place as a society with our masculinity, with men, because of the poor levels overall of hormones and testosterone and the incredible amounts of compounds that we're, exposed to every day, that is in the last year just has come to light more and more and more about all the chemicals and all the preservatives and dyes and things that are just dumped in our foods for the sake of, I don't know what the sake was for, of profit potential, I guess. And we are the ones that have suffered. We do an interesting thing, if I may, called EBO2 therapy. And it is the single most effective thing I have ever seen as far as detoxifying someone. So can be part of the ultimate Aspen experience. It was developed by one of my mentors, Dr. Joe Parita, who's an orthopedic surgeon down in Miami. He's done more stem cell work than anyone in the United States for sure, maybe the world. He's been around a long time. So this is a form of ozone therapy, but and it's an actual loop of 5 to 7 liter blood exchange where the blood literally comes out one arm, goes through an actual dialysis filter, then is supercharged with ozone. And before coming back in the other arm, it's changed from dark purple to bright red because it's so oxygenated. It goes through a photomodulation unit that treats it with 4 different wavelengths of light to sterilize the blood. And when I first heard about it, I'm like, you got to be kidding. My blood's sterile or I'd be dead. But guess what? We're full of viral particles, of candida. I test people for mycotoxins and mold they've been exposed to. They have chronic illnesses that somebody just isn't recognizing. When we do the mycotoxin testing, they're off the charts. We send it to a special lab in Dallas. And after we've done 2 or 3 of these over 2 or 3 months and retest, those levels are nil. It is quite dramatic and people feel fantastic. Now, you don't have to be sick with yeast or mycotoxins in order to benefit from it because the energy boost from cleansing the blood, they say we get a credit card worth of plastic in our bodies monthly now.
Oh, that's crazy.
That's really scary. And where does it go? Our brain, our bones, places we don't want it. So, I think that finding more and more people that are very interested in that therapy as well to just further, optimize their health and help them to regain, that vitality that sometimes is just lacking when things are not as they should be.
Wow. Okay. I mean, I think a lot of what you mentioned is very eye-opening, just how much is out there, even if you're trying to stay healthy, even if you're trying to eat well and exercise, there's all these other things that you just don't realize that's negatively affecting your health. And then there's also solutions to help with that health or solve those health issues. So, Dr. Gershon, let's say somebody is looking to they want to feel healthier, they want to perform at that peak level, and they're looking for a provider in this space. What would be the most important piece of advice you would give to someone who's looking for this type of treatment, but they don't know which provider to go to?
Well, first of all, I treat people from all over the world. With telemedicine, I have people that come to Aspen in the summer or the winter, or visit me in Denver. Once we've established care, then we use LabCorp or Quest Labs anywhere in the country. I have patients right now in Spain and Thailand, and there's Mexico. I'm opening an office very soon in Cabo San Lucas in partnership with ReHealth, which are friends of mine that have a stem cell and exosome clinic there that are very reputable. And so we can always help guide people, whether they choose us or not. There are health directories. So through the American Academy of Anti-Aging and Regenerative Medicine, there's a website called worldhealth.net, and people can go there to look for a qualified provider that's board certified through that organization. Also, WorldLink Medical, which is the teaching arm for Dr. Neil Rouzier, my main mentor for 20 years, have providers. There's things like Avexius. Avexius is a pellet company that does great trainings there, and everyone there was trained by Dr. Rouzier. So when I've gone to learn their pellet insertion techniques for testosterone and estradiol for hormones for men and women, I was very pleased to know that we're all singing out of the same hymn book, so to speak. So there are a lot of different things, and people can look at our website at aspen-regenerativemedicine.com. I talk about this on my podcast as well, which is the same title as my book, which is a bestseller on Amazon, Beyond the Fountain of Youth, and make it a personal search. I encourage people, the more you look, the more you learn. Don't believe everything you read on the internet. There's as much garbage out there as there is good information. So you have to try to find a coach to help you discern what really can apply to you and help you, and what fits your budget and makes sense to your lifestyle.
Mm-hmm. And where do you think the future of regenerative medicine is going?
Well, I think we're just headed in the right direction. I've done this for 22 years and had to deal with hundreds and if not thousands of patients that I went to my family doctor. Testosterone is going to give me prostate cancer, or for women, my girlfriend said I'll get breast cancer. Even providers, there was a lot of information that came out from what was called the World Health Initiative back in 2000 or 2001 that scared everyone on the planet out of using hormones. But the unfortunate part that wasn't revealed is the dangers and all the things that happened there were primarily all seen with, or almost exclusively seen with, synthetic hormones. We don't use synthetic hormones for women that are made from a horse's urine. We use natural bioidentical hormones that were extracted from yams. And so they're very safe and they're very effective. And so as far as the changes, I think that gene therapy is something that we will have to deal with in the near future. And not in a negative way. I mean, there's so much information. We can use the information now to help guide someone that perhaps, let's say, is lacking the MTHFR gene, so they don't metabolize certain medications or vitamins properly. So there's a growing field of testing that is becoming reasonably priced that we can do to see how that applies to individuals. And then CRISPR technology, things that are out there that they are making a difference with certain inherited diseases of childhood, dramatic life-saving things. And so it's not mainstream where everybody knows about it yet, but there's a lot of things coming. And I think that we will see a lot as far as longevity, our lifespan. God bless my dad, made it to just about 101, which is good living. My goal is 120. And so we'll see. I think that we'll see 100 become an average in the next 10 to 20 years. We will see people living longer, not just in the blue zones. That's something very fascinating. Dan Buettner's work with National Geographic. I got to hear him speak last year at our Academy meeting. It was great. And anyone can Google that and learn. You don't have to move to Sicily or Sardinia to benefit from that. But it's lifestyle, lack of stress, natural foods, daily exercise. And I don't mean an hour and a half in the gym or on the treadmill, being active, doing things. And when we balance hormones, micronutrients, diet, exercise, everything else, I mean, the sky's the limit with really being able to maintain our best version of ourselves, whatever that is for you or I or whomever, and for as long as possible. I won't get into discussions on eternity and all that. I have my beliefs, and I think that the goal is to live your best life as long as possible.
Yeah. I think that's a message everyone can get behind.
Yeah.
Not only living a long life, but also a very healthy life, a good quality of life as well.
Right.
So now with your practice, the Aspen Institute for Anti-Aging and Regenerative Medicine, what is your vision for your practice?
For my practice, to just continue to expand it to as many people that want to listen and impact people in a way that makes a significant change. I saw a woman today to do her testosterone pellets. I haven't seen her in 3 months. And her husband came to me initially and then brought her in. I almost didn't recognize. She's lost 30 pounds in 3 months.
Wow.
Hormone therapy, we're using some microdosing of GLP-1 medication, and she feels so good. I mean, she's like, I just feel lighter. Everything's great. She was low on thyroid. Unfortunately, most providers in the U.S. don't really treat thyroid correctly. We only look at TSH, thyroid stimulating hormone. And that, things have to be off a lot before TSH actually starts to rise. It's not a great test, but that's how we were trained. We look at free T3, kind of like we look at free testosterone. What is the circulating bioactive level of hormones in someone's body? And sometimes just making small changes can be dramatic, and dramatic changes in their daily activity, energy level, you name it. So it was really exciting to see her today, and after just a few months to see a new person walk in the door. And she's, I don't know, 36. I mean, she's a young woman. Just looked fantastic and felt great and had been in a rut and tried everything and just a little testosterone, a little of this and a little of that, and some good nutrients and a little more active lifestyle, and she's a different person.
Wow. So really can turn lives around, really change lives.
Definitely.
Incredible. Well, Dr. Gershon, I have one last question for you, but before I ask it, I do want to point you to your website you mentioned earlier, aspen-regenerativemedicine.com. Now, my last question for you is, what does beauty mean to you?
Well, it's changed over the years because I used to own and run medical spas in my practice when I was in the Dallas area in Denton, Texas. It's not just how we look to others, it's what we see in the mirror and how we feel, really having vibrancy, vitality, feeling like we did 20 years ago or as a young adult. I ask people, well, how do you feel? I give them a checklist of their symptoms. How do you feel today to when you were 20? Well, if you're 50 or 60, it's like, hell, I don't know. But you know what? I felt great. I took everything for granted. We worked all night, went out with our friends. It didn't matter how much sleep we had. We felt great. Well, obviously that changes as we get older. And when you have that rundown feeling like you can't keep up, you can't enjoy your own kids or your grandkids or the people you like to be with, and the couch sounds good at the end of the day, that's not why you work hard your whole life. You work not to just make money, but to have a lifestyle that you can enjoy with the people you love. So for me, that's what real beauty is, and being balanced. And spiritual health is very important to me, nutritional health, obviously our physiology and our hormone health, and everything is tied together. Nothing is independent. We may think it is, but the time will come when you'll see it all matters. And the more that we address every small area of our life, the better we feel, the better contributions we make at work or as a father or mother or brother or sister. To me, that's what beauty is.
It's a great definition. Okay, well, there you have it, Dr. Gershon, sharing his expertise. Doctor, where can people contact you in your practice?
Well, you can go to aspen-regenerativemedicine.com. We're on Facebook, Instagram is just Dr. Julian Gershon. We're constantly posting things there. Listen to my podcast on YouTube, Beyond the Fountain of Youth podcast. Pick up a copy of my book on Amazon, Beyond the Fountain of Youth, or call us. The area code is 970-201-1332. And, we're around, and if we're not here, the phone is answered. We have on our website a chat bot so that we can capture your information, answer questions for you. There's a lot of answers for things that may be troubling you, that even as good as your family physician, cardiology buddy, whoever is, they may just not have the information. So I just encourage people to make it a study. You are worth it. You need to be the one to do the deep dive into all the information that's out there. And there's now some great authors and podcast hosts. Everybody knows Joe Rogan. We know what Bobby Kennedy Jr. is trying to do for the health of America. There's a lot. The academies that I mentioned, WorldLink, worldhealth.net, the American Academy of Anti-Aging Regenerative Medicine, go check it out, really become a student of the process.
Well, there you go, Dr. Gershon. This is awesome. Thank you for coming on. Thank you for sharing all of your knowledge, and thank you for sharing your message.
Thank you. My pleasure. And I look forward to working with you down the road.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.